I'll now go on to a study of Ganetespib. This is a heat shock protein inhibitor. This is a class of drugs that has been one of significant interest to me. HSP90 is a very ubiquitous protein in the cells. This trial, again, was looking at standard docetaxel or Taxotere and looking at the possibility of adding this HSP90 inhibitor. The study had good rationale. I won't spend a lot of time on this slide, but you can see that xenografts, which means that these are tumors that are artificially implanted into animals, were more likely to shrink if you gave them a combination of Ganetespib and docetaxel. Patients on this study were randomized 1-to-1 between Taxotere alone versus Taxotere and the studied drug Ganetespib, the HSP90 inhibitor. One thing that I will point out here, because it does become fairly significant, and this, I almost hate to do this because it gets to be a very, very sort of complex mathematical argument, but I think it does in this case end up being very important for analyzing the data, because among other things it may help answer the question for the people who are calling in, why is this drug not available already based on the data that is presented. What they did is they looked at 4 different stratification factors. They looked at the ECOG performance status, they looked at the time since diagnosis, whether it was less than 6 months or more than 6 months, baseline serum LDH, and smoking status. Then they looked at 7 different endpoints. So progression-free survival in KRAS mutant patients, in patients with elevated LDH, progression-free survival and overall survival in patients with adenocarcinoma, and I'll show a little bit why adenocarcinoma specifically, and also response rate, something called disease control rate, and quality of life. So in the end, they really looked at 7 endpoints with 4 stratification factors. The reason that I point that out is it's going to help interpret the results when you realize that in the end, in some ways, they're doing 28 different experiments because they have 4 different stratification factors and 7 different endpoints, making it a little bit more complicated. After a bunch of patients were originally randomized, they saw that they didn't have much effect in patients who did not have adenocarcinoma, so they stopped enrolling those patients, then did their analysis on adenocarcinoma patients only. The response rate was pretty similar between the 2 arms. G plus D is the Ganetespib plus docetaxel or Taxotere. The other arm is Taxotere alone. However, when you look at the progression-free survival, it certainly looked like the combination was a little bit better. Now, again, this is restricted to the adenocarcinoma patients because they stopped enrolling the squamous cell patients and then didn't analyze them with the rest of the group here. Overall survival, again, there was at least a suggestion that there was a survival advantage in the adenocarcinoma patients. So then they went through all of their subgroups, and in particular, they saw that in patients whose disease was 6 months after diagnosis, in those patients they had a fairly significant improvement, both in progression-free survival and overall survival. Now, the reason that I went through sort of the complex math issues, because I think they're a little bit important in interpreting this data, because these p-values that they have for this shows that the likelihood that these results would be seen by chance are generally extremely low. So one might wonder why this drug isn't approved today. The issue is, I think the way to think about it is that it is very unlikely that a family would have, for instance, 5 daughters, that they would have 5 children, all of them would be girls. On the other hand, if you look at enough large families, the likelihood that you'll find one that has 5 girls ends up not being so insignificant. So the fact that they looked at 28 different groups and then had a very significant finding in 2 of those, it's, I think, still a little unclear. What they are doing, of course, is the appropriate thing in such an event, and that is they are going to go forward and they're going to run then a larger study, presumably trying to confirm the results. And I believe in the talk at least indicated that they would be looking specifically at these patients who are more than 6 months out from the time of their diagnosis.
Thanks for listening. If you like and learn from our GRACEcast, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts in the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our Grace website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support.